Hello, and welcome to the orientation to the Community Health Core Service Standards and Protocols hosted by the Department of Health and Social Services. The objectives of this orientation are to define what are standards and protocols, describe the process that was used to develop the Community Health Core Service Standards and Protocols, describe the purpose of the standards, provide an overview of the components of and how to use the standards, describe the purpose of the protocols, provide an overview of the components of and how to use the protocols, and lastly, to explain what the standards and protocols are not. A standard is something established as a measure or model to which things should conform, a statement of expectations to describe the basic rules that must be met, an identified requirement that should result in specified outcomes and goals, and lastly, a basis for developing audit tools. A protocol is the working set of rules and specifications that are used to make something happen, in this case, to meet the standard. A rule or specification that is applied to every specific situation. For example, not all rules are applied in every situation. This slide is a brief overview of the process for creating standards and protocols, which will be described in the following slides. The process for developing standards and protocols involve multiple components. In this case, it involves determining the identified current health services that are delivered in the community setting, reviewing the need for additional services, and ensuring that standards meet the current criteria for high-quality care as defined by the Canadian Institute for Health Information, known as CIHI. This includes whether it is evidence-based, whether it is patient and family-centered, whether it is safe, and whether it is timely. Process written to capture the elements of legislation, policies, and guidelines, and translate them into clear, objective standards. They're developed at a level to advance the change or shift required in care delivery. For example, the use of services rather than programs. Not focusing on the provider, but rather the patient and the service. And the expected outcomes related to health rather than the structure. This is where the biggest change is. If looking at the previous standards, for example, the fireweed binder, the key elements are very similar, if not the same. The biggest shift is that we are not looking at a program of well child, but rather looking at the individual child to attain or maintain a state of wellness, so that, should the authority choose to deliver a well child program, this is still very possible and fits into the standards. But in some communities or regions, if you would rather want to run an immunization program and target children, then you can do this. How you develop a program or deliver the service is up to you. Please note, this process is not focusing on the provider, but rather on the patient and the service. There is a rule for each person involved in delivering services in the community that needs to be met. This provides the authority with the criteria to develop tools that ensures all service providers deliver care to a standard that ensures the wellness of the resident. We also want to empower the patient to take ownership in their role in meeting a standard. There are three purposes to the standards, which we will elaborate on in the following slides. Number 1, standardized, consistent, high-quality care for equitable health service delivery. This includes accountability, continuous improvement, such as using quantitative and qualitative data to measure, evaluate, and improve health service delivery, clinical effectiveness, evidence-based practice, reduce risk and improve quality and safety, service delivery consistency, and workforce competence, such as continuing professional development and enabling individual service providers to complete audits on services delivered. Number 2, to define fundamental core community health services. Includes assessment and surveillance, health promotion, disease and injury prevention, health protection, health maintenance and restoration, and provision of curative, chronic, rehabilitative, palliative, and end-of-life care. We are not new to delivering healthcare. We are not recreating the wheel. We are not establishing any new services, but we want to ensure that we all are on the same page in addressing the key elements of health delivery. The data needs to be collected on individuals within a certain population in a specific community, but also as a whole region, and this can actually be done. This includes assessing and surveying, promoting health, prevention services, protecting the health of our residents, and providing care. in the acute setting, but also in chronic and palliative, and across the ages. And lastly, focusing on the patient by ensuring patient rights, access to care, continuum of care, quality assessment, care planning with patient and their family or caregiver, delivery of care in a culturally safe context, and education and information sharing. This is a bit of a shift. The patient has always been the focus. Since separating from the federal government in the 1980s, when we were using integrated service delivery model where the patient was in the center. However, we structured community health on the programs to ensure the patient was the center. Now we are focusing on the individual and working to ensure they truly are and truly feel like the center. Focusing on their rights, ensuring the access, and refocusing the care on key health elements such as cultural safety. We are not only delivering an education program, but ensuring that education and information sharing is a two-way street. And that leads us to the components of the standards. The Community Health Core Service Standards uses the lifespan approach as it applies to and is to be used across all life stages and combined with other applicable core service areas, such as infant and child health, adolescent health, adult and elder health, and maternal health. Things like tuberculosis programs can apply to all age groups and need to be considered at all life stages. But we did not want to limit a program, but rather focus on the patient and service delivery. Or, for example, immunization programs crosses the lifespan, but of course is a focus in the infant and child stage, but really needs to be considered and actively pursued at all life stages. The components that the standards rely on are creating partnership and working with the community, creating a strong team, delivering safe care, access to quality information, and monitoring and evaluation. I think it's fair to say that we, as healthcare providers, but more so as those that are responsible for ensuring the safety and health of our residents, have concerns around community health services due to high turnover, some struggle with continuity of health providers, changes in structure, and etc. But in the same breath, we also have this great opportunity for shifting how we think so that within this environment, we have so many positive things to use as building blocks. We have the Truth and Reconciliation Commission that has really brought to light how important partnership, empowerment, and listening are to ensuring health and safety. So the components that we rely on to give us this opportunity. If when you review these, you find that the standards do not do this or do not provide you, the authorities, with this opportunity, this is the feedback that we need. We need to ensure that our responsibilities to our NWT residents for health and safety were addressed in such a way that those doing the front-end work have the tools to do so. How to use the standards. Each individual delivering health service will need to know the standards. We expect you to be familiar with each section, develop required timelines, be familiar with the expectations, and review employer audit tools to be familiar with key expectations. We've created a one-pager referred to as the desktop reference, which is available on the HSS Professionals website. This is an example of what a standard looks like. At the top, you will see the lifespan section, in this case, maternal health, followed by the main topic, postnatal care, and the subtopic, maternal postnatal care, and the outcome, the expected result of successful delivery of health services. Below, you will see the program requirements, which outlines elements of service delivery, which were developed using the evidence-based practice and rooted in NWT context. These are the audit requirements the Department of Health and Social Services will use to monitor core services delivery. Lastly, there are the indicators. These are the audit indicators that the Department of Health will use to measure the successful implementation of the core services delivered. The purpose of the protocols are to provide a working set of rules and specifications that are to be used to meet the standard. For example, using the Well Child Record, using the preventative care forms for adults to ensure all health promotion topics are addressed, or the use of the tuberculosis manual. In 3 slides, we will show you what the protocols look like. The protocols help to describe how to accomplish the standard, how to ensure you can meet or exceed the standard, that is the protocol. The components of a protocol include a list of expected procedures, forms, or recommendations that are to be used to implement the outcome criteria to be met. There will be more detailed protocols on the next slide. This is a quick example of what it looks like. Here's an example of a protocol using the maternal postnatal care protocols. For the example, let's use the actual document. We will first back up a bit for where we described that the standards are based on legislation and policy. In the community health policies, Policy 402, Community Health Nursing Practice, Employee Responsibilities. The registered nurse must ensure compliance with responsibilities when hired. The policy states, the registered nurse shall practice within the policies, procedures, guidelines, and protocols of their employing agency and within professional standard and code of ethics. For example, if you open the standard document and go to section 5.3, a postpartum patient presents for a following appointment. Newborns, parents, and their families are supported as they adjust to their new situation. To do this, let's look at the standards. Go to maternal health, postnatal care. One standard the nurse needs to adhere to is they must ensure the information from the delivery site is available, and this is demonstrated by the documents being on the patient's file. How would I, as a nurse delivering the care, be able to go back and audit my own practice, or I, as the nurse in charge, ensure the standard is met? I would use the indicator, which says the information was obtained, it is on the file, or possibly referenced to in a note, etc. The protocol to accomplish this, or the rule that is applied, is discharge summary and record of birth is obtained from the hospital or midwifery unit and documented in client's records, referencing page 5 to 12 of the standards. We know that this can help a patient feel supported as they do not have to repeat their whole story. They feel secure knowing their chart is up to date, so should there be any specific follow-up or issues identified, they can be addressed in a timely manner. How to navigate the document. At the beginning, there is a contents page, which has hyperlinks to each section. There are also hyperlinks at the bottom of every page that allow you to return to the table of contents, to return to the top of that section, or to go to the next section. What the standards are not. They are not a clinical practice guideline, and they are not a tool to use in place of clinical judgment for an individual client interaction. As previously mentioned, a desktop reference has been developed, which is a quick look guide. It should be easily accessible. We ask you to please post around the facility and save a link on the desktop. And it was designed to be user-friendly, specifically for nurses that are not long-term. This is a tool that you can share with other healthcare providers to inform them of standards. This is what the quick reference guide first page looks like. And this is the second page. We thank you for taking the time to learn about the NWT Community Core Service Standards and Protocols. Should you have any questions, comments, or concerns, please do not hesitate to send an email to nursing@gov.nt.ca. Thank you.